A new bipartisan caucus is forming in Congress focused on the treatment value, the therapeutic value of psychedelics. Joining us now to talk about this new caucus for the first time are two of the people that have helped to organize it. I want to welcome on here John Lubecki, who is the VP of Communications for Apollo Pact. Also, Marcus Capone is a co-founder and chairman of VETS, which stands for Veterans Exploring Treatment Solutions. Both of you, thank you so much for joining us.
Thanks for having us.
And so, John, can you talk a little bit about first of all, for people who are just watching this who aren't kind of Hill rats, what is a caucus, first of all, and what is this caucus going to be? Who's going to be in it?
So a caucus, very simply, is a group of people in the House who all work on one thing. You've probably heard of like the mental health caucus. There's a veterans caucus. The biggest ones are the Democrat caucus and the Republican caucus. So some of them are very partisan. For example, the Republican and Democrat caucus. This is an entirely bipartisan caucus. There's two co-chairs, retired Lieutenant General Jack Bergman, who represents the Upper Peninsula of Michigan, and Lou Correa, who is a congressman from California. Both of them stated that the reason they joined is because it touched their family, and they see how mental health is not just affected their personal families, but they see it in their communities, as we all do. And they decided to come together and, psychedelics, drug policy, these have typically been things on the left. It's great to see people like Jack Bergman step up from the Republican side, as well as there's actually been a lot of interest by members. We don't have a set list other than the two chairs, because every Republican that wants to join has to go find a Democrat. Every Democrat who wants to join has to go find a Republican. So we've had some Democrats and several Republicans show interest in this. And I spent a lot of today telling them, go find a Democrat, go find a Republican. Some of the people who've shown interest is Andy Barr, Rutherford, Nancy Mace, Earl Blumenauer from the Democrat side. It's going to be interesting. And one of the best parts about this caucus is it's got a very tight focus on advancing research, funding for research, removing barriers to research, and then when that research is all done, making sure people have access to all those therapies.
Yeah, Marcus, what are some of John just sort of got into it a little bit, but what are some of the big kind of ticket items that this caucus can help advance sort of immediately in a new Congress? We know the margin is going to be slim, which is great for bipartisan efforts, and especially great for bipartisan efforts that have specific legislative items on their agenda. So what are you most hopeful for, and what do you hope that they're looking at right away come January?
Well, I think the most important thing that the public just needs to understand is that we're just trying to advance research in the field of psychedelic medicine. I think, in the 50s and 60s, psychedelics got a very bad name because these were medicines that were used as recreational drugs. We need to steer completely clear of that. These are, medicines that need to be applied with therapeutic use and medical application. I think if everyone can wrap their head around these being medicines that needs wraparound preparation, integration, support, I think all of us can agree when they're applied in a controlled environment, as we're starting to see in some of the research that are coming out, these are medicines that provide true healing compared to some of the, current, old treatment modalities that we've been using now for almost 35 years.
Are you facing any opposition from the pharmaceutical industry, John, or are they still not threatened by the kind of the rise of therapeutic psychedelics? Or do they think they can get in on it?
Yeah.
I will say I think they think they can get in on it. I mean, let's look at Big Pharma. A lot of what they do is they go buy companies who have new technologies. They don't really create new things themselves. They just go buy them. So I do think that some of these companies may eventually be bought out by a Pfizer or a Merck, especially the for-profit companies. That may not happen. They've pretty much stayed out of it. They haven't invested their capital and their lobbying time in all of this. We're not part of big pharma in any way, and they've stayed away from us. They know it's eventually coming, but there's also delays. But there is opposition. A couple of weeks ago, you were talking on this show about some things that Jesse Waters had said on Fox News, and there's other pushback, in part due to negative outcomes, because these substances aren't always used in a therapeutic environment. They aren't always used in with proper integration, proper preparation, properly trained therapists and other people who can help people heal.
And both of you can speak to this, but I'll start with you, Marcus, how it's specifically beneficial to talk about the experience of veterans who are helped by these treatments. I mean, obviously, the evidence suggests a lot of people can benefit from these treatments, but I imagine, especially when you're going to members of Congress, being able to talk about the experience of vets has to be a powerful tool for advancing that cause more broadly.
Yeah, it's extremely powerful. My wife and I started VETS 5 years ago after, my successful experience with psychedelic treatment down in Mexico at a reputable retreat. I had been on from that moment, I'd say 7 years straight of antidepressants. And at one point I was taking up to 10 prescription medicines to include medicines to focus, Nuvigil and Provigil, and antidepressants, SSRIs, SNRIs, medicine to go to sleep. The day I'd say the week that I went to this retreat, I haven't touched an antidepressant or another pharmaceutical now in 5 years. The healing was so profound, we felt really necessary that we had to pay it forward to my community, the SEAL community that was coming back from 20 years of sustained combat. Many of my friends are struggling the same way I did, and we felt the need to pay it forward. And what we wanted to get 12 individuals the first year, I think we funded 35. And now to date, 5 years later, our nonprofit has funded at roughly $5,500 per individual, almost 700 other special operations veterans to receive the same treatment. And the testimonies that we get are unbelievable. It makes us keep going. These medicines, again, as Jonathan pointed out, done in a controlled environment, life-saving, life-changing. It's keeping families together. It's making individuals, connect back with their spouse, their loved ones, their children, and this is generational healing. And so we just need to continue on and do this smartly. We don't want another Timothy Leary moment to happen.
Marcus, did you say Ibogaine? Is that?
I didn't say anything, but you did.
Oh, okay. Do you have any? If people are, you have to do this in Mexico or somewhere else. You can't do this in the United States.
It's legal. We can't fund anybody where these medicines are not legal. So in countries where they're legal, certain medicines are legal in Mexico, some in Costa Rica and Peru, some in some countries in Europe, and so we just have to be very careful.
Do you have any advice for people who are suffering, who are trying to search for medicines, solutions outside of the country, and so that they stay safe? What are the ways that you can identify facilities that are safe versus ones that are just in it for a buck?
Yeah, there's plenty out there, as you can imagine. All of a sudden, there's a lot of quote unquote, pop-up medicinal shamans that all of a sudden think they know what they're doing, but we're so early. This is, ground floor, even though there are, of course, different communities that have been using these medicines for thousands of years, but they've grown up, using these medicines. And individuals have to be really careful. I definitely don't recommend, somebody just hopping on a plane and going to a random place and hoping, they get a life-changing experience. I mean, we put a lot of effort, a lot of research. We're using experts at a lot of the top medical institutions, Johns Hopkins and Stanford and Harvard and Mount Sinai to help us. But it's so early on, we really need to see the research. I wish I can say, if you're really struggling, go hop on a plane and find one of these places, but it's not the way to do it. I think we have to be really careful because, again, there are risks to these medicines if done incorrectly.
John, before we run, can you tell us, there are a lot of causes that aren't able to organize to the degree that this one really is starting to. And now with the addition of the story that Ryan and you guys broke here tonight, what does this add, the caucus, sort of what does it contribute to the momentum of the movement going forward? What does this mean for the movement overall?
Well, the biggest thing is it's both sides coming together and having a voice and being able to push out and talk about. One of the things I know the caucus is planning on is 4 briefings next year on various topics involving psychedelics to inform all members of Congress. There'll eventually be legislation and amendments and other things. The biggest thing is this is the left and the right coming together saying, look, medical shows this amazing potential to change lives. We need to get the research done, get the answers we need, and get people the help they need. Then we can deal with some of the other larger questions on spiritual use and other things. But this prevents things from going off the rails the way they did in the 70s that led to a backlash and all these things being made illegal and unavailable and unresearchable. Having a caucus, led by people like Lou Correa and Jack Bergman, with what they bring to the table, as well as some of these other people who have shown interest. It's the way to keep things on the straight and narrow and preventing, as Marcus said, a Timothy Leary moment where everything goes off the rails. Everybody says, nope, stop it. Because the second that happens, I know I have friends that's a death sentence for. I know Marcus has friends, the same thing. And I can't personally allow that to happen.
And Marcus, about 20 years ago, I was a lobbyist, state-level lobbyist for medical marijuana. And one of the things that we had to overcome at the time was kind of the laugh factor, the chuckle factor. Like people didn't really take it seriously. Today, so many people know so many people who are cancer patients and others who are seriously benefiting from it. That's no longer an obstacle for those policy advances. What kind of familiarity with the therapeutic value of psychedelics are you finding when you talk to people on the Hill? I'm curious both when it comes to staffers, but also when it comes to members of Congress. Have they heard enough about it yet from people close to them that they're taking it seriously, or are you more often just getting jokes?
Yeah, it's a great question. Definitely don't. I don't want to get in cannabis. I don't really, I don't understand the cannabis fight, but I do understand the psychedelic medicine fight. We're seeing things across the board. So we are seeing individuals that have been hearing about the research. We definitely know there's a lot of staffers, I think, because they're younger and they might be connected to individuals that have been, have attended these retreats or have done, say, ketamine-assisted psychotherapy here in the States that is, being used legally off-label in clinics. There's definitely most of the leaders, on Capitol Hill have at least one degree of separation of an individual that has been in the military, that has served, that has come back, and that is struggling with mild traumatic brain injury or PTSD. Many that we have talked to have taken their own lives, others that are just really struggling with opioid or alcohol use disorder. And so, they've been through the kind of Western medicine approach of these antidepressants and mood stabilizers and brain clinics and talk therapy. It's just not working for a lot of us. And, when you find something that is so healing, you just want to be able to share and be able to introduce it to everybody else so they can also, enjoy the life that, I feel like I'm living right now and Jonathan and others. And so, we'll do everything we can to, I think the biggest thing, we 100% need the science. That's going to happen. We know for a fact this won't happen without science and research, but we do need a lot of storytelling. A lot of these anecdotal stories are very real. My wife and I every day receive, text messages and emails and say, hey, you saved my life, you saved my family. I don't know how much more you need than seeing those. And kind of what keeps us going every day. And so, with the introduction of this caucus, the introduction from Dan Crenshaw with the NDAA amendment that, again, will hopefully release federal dollars to study these medicines more. I think we're on a really good track and in a really good place. And again, we just have to be careful and how we roll this out and make sure we're doing it safe and to protect everyone.
Well, Marcus and John, you guys are doing the Lord's work. Thank you so much for joining us, and congratulations on the advent of this new caucus.
Thank you so much. Appreciate the time tonight.
Yeah, hopefully they call it Noah's Ark on the Hill. You know this, where they go 2 by 2. So if you're going to come on, if you're going to join the caucus, you have to bring a Democrat with you. And they're trying to get people who are considered to be kind of moderates, and so that it's something that gets taken seriously. Because if you could get 10, 20 folks on this caucus, like that's a swing block that can then go to McCarthy and say, look, you want our votes. Then we just want you to free up some, or just ease some of the laws that allow the funding to flow. You don't even have to. You don't necessarily even need taxpayer money.
Well, yeah, the importance of it is what you just said. It can be a swing block. So good for them for organizing. Like you said, they're doing the Lord's work.
Well, thanks for watching another Counterpoints Friday. I guess next week, Thanksgiving.
That's right.
We're gonna tape it a little bit early.
Right. So there'll be, I believe, a Wednesday show next week, so we can send you to your families with plenty of fodder for a dinner table discussion.
Yep. There you go. Yes. Be well behaved. Not everything has to be a fight.
Well, we can give that advice next week. Maybe next week what we'll do is give our Thanksgiving throwdown advice.
How to pwn your uncle.
Yeah, exactly.
Yeah. Excellent. All right, well, have a great weekend, everybody.
Hey guys, ready or not, 2024 is fully upon us now, and Sagar and I have been brainstorming ways that we can really up our game for this critical election.
Yeah, we rely on our premium subs to expand our coverage, to add staff, to upgrade the studio. We just want to give you the best independent coverage of this election, which is possible. So if you can help us out, become a premium subscriber today, breakingpoints.com, or the link is down here in the description video. It really means the world to us, and if you like what we're all about, this is the best possible way to keep us 100% independent, working only for you.